So, with gratitude for his leadership and his persistence and determination to make American health care great again, it is my high honor and distinct privilege to introduce to these families and to all of you the 45th President of the United States of America, President Donald Trump.
Madam President, it is unconscionable that the United States Senate will soon be voting on a measure that would force between 22 and 32 million people to lose their health insurance. This vote is particularly unconscionable when you consider that each member of this chamber has high-quality health insurance that will be there whenever we need it. And we all will, as I certainly found out. I know as well as anyone that we are all one diagnosis away from a serious illness. When I was diagnosed with kidney cancer not too long ago, I had the peace of mind of knowing that I was covered and that insurance would make the cost of treating my illness more manageable. Many of my colleagues on both sides of the aisle have found comfort in having high-quality health insurance as they confront serious illnesses and injuries of their own. Every American deserves that same peace of mind. And that's why I'm fighting for universal health care that's a right for every American, not a privilege reserved only for those who can afford it. This is something we can and should be working on in a bipartisan fashion. And there are a lot of great ideas we could be debating and considering to move us toward this bipartisan goal. Instead, the majority leader and his allies are forcing a vote on Trump Care, a mean, ugly bill that will deprive tens of millions of people across our country the health care they deserve.
Well, thank you very much, Vice President Pence, Secretary Price, and thank you, everyone, for being here today. For the past 17 years, Obamacare has wreaked havoc on the lives of innocent, hardworking Americans. Behind me today, we have real American families, great families, just spent a lot of time with them, who are suffering because 7 years ago, a small group of politicians and special interests in Washington engineered a government takeover of health care. Every pledge that Washington Democrats made to pass that bill turned out to be a lie. It was a big, fat, ugly lie. Democrats promised Americans like Steve Finn, a former police officer in West Virginia, that they would save $2,500 a year under Obamacare. Instead, his premiums have more than tripled. That's pretty bad. As a result of Obamacare's skyrocketing costs, Steve and his family and many of his employees had no other option than going on Medicaid and giving up their existing coverage. That's pretty bad. Pretty bad. No choice, right? No choice. For them, Obamacare's promise was a nightmare. Marjorie and Kevin Weir from South Carolina have a son, Monty, who suffers from spina bifida. Washington Democrats promised families like the Weirs that if they liked their doctor, they could keep their doctor. But now there is only one insurer left in the state exchange. And Marjorie says that every year she waits anxiously to learn if the doctors and hospitals, which her son needs the most, will remain in their network. More Obamacare lies. And you've seen that up front, unfortunately, up front and personal. The Democrats promised Melissa Atkinson that her son's pre-existing conditions would be covered. The Atkinsons quickly learned that Obamacare's promise of covering for pre-existing conditions was meaningless, though if the doctors you need to care for you aren't on your Obamacare plan. So you just have a meaningless promise, and everybody knows it, and most people on Obamacare know it. After an excruciating series of events and complications, Melissa and her husband found themselves just before Christmas, emotionally and financially devastated, crying in a doctor's office faced with yet another seemingly unpayable bill. When insurance wouldn't cover the Atkinsons' care, they emptied out Melissa's 401k to pay their bills. They're not going to be, and they haven't been the first. There are many, many cases such as that, the 401ks.
Although some have argued over the past week that this vote is doomed to fail, we can't be complacent. We have to keep fighting. Because if Trump Care becomes the law of the land, it would be devastating for tens of millions of people across the country, harming the poorest, sickest, and oldest members of our society. And it undermines protections for Americans living with serious and chronic conditions who could face the reimposition of yearly and lifetime caps on their care. It would impose an age tax on people 50 to 64 years old that would allow insurance companies to charge them up to 5 times more for insurance because of their age. I could go on. Because for hundreds of thousands of people in Hawaii and tens of millions more across the country, Trump Care is not an abstract proposal that would have no relevance to their lives. I've heard literally from tens of thousands of people from across Hawaii about the devastating consequences Trump Care would have on their lives.
The first rule of medicine is do no harm. But Obamacare's lies have caused this, and throughout the whole country, families like this, nothing but pain. Aaron and Andy Witzik are small business owners from Illinois. They have 6 children. Their youngest daughter, Poppy, has a rare genetic condition. Children born with it are sometimes called butterfly children because their skin is as fragile as the wings of a butterfly. Poppy has to wear special bandages all of the time. Unfortunately, under Obamacare, Poppy's insurance has been repeatedly discontinued and replaced with what Washington deems equivalent policies. But for Poppy, these plans are not equivalent, and Poppy's family has to spend precious time and tremendous resources fighting for exceptions for Poppy. The Washington politicians who made those promises to Steve, Marjorie, Melissa, Aaron, and their beautiful children want to ignore all the pain, all the suffering, and all of the money, the tremendous amounts of money that these lies have caused. They want to forget about the countless Americans they've hurt and the many that they are continuing to hurt every day by refusing to help us replace Obamacare. For the last 7 years, Republicans have been united in standing up for Obamacare's victims.
And Hawaii is a small state, and when you think that literally over 20,000 people in Hawaii have contacted my office to tell me the devastation that Trump Care will bring to their lives, this is because insurance is personal. They've spoken out against this bill loudly and clearly because health care is personal. Keith Moniz from Maui has a particularly compelling story to tell. His brother, after working as a custodian for more than 40 years at St. Anthony's School, Keith's brother Lester lost his job and his health insurance. Only a few short months later, Lester, Keith's brother, had a debilitating stroke that left him permanently disabled. Fortunately, Keith's brother was able to obtain Medicaid coverage that is now a long-term resident at Halemakua on Maui, where nearly 80% of all patients and residents rely on Medicaid to pay for their necessary care. Keith was very clear about what would happen if Trump Care succeeded in making large cuts to Medicaid. And I quote Keith, "It would be devastating," he said. "We had a difficult time taking care of him," his brother Lester, "when he was at home, and he's gotten the care that he needs at Halemakua. It would be a big loss. I don't know what we would do. Where would we be able to move him to?" End quote. Alvin, another resident at Halemakua, was paralyzed in a car accident in 2006. Alvin lived with his aunt and uncle for a short time after his accident, but the complexity of his care was too much for them to handle on their own. Alvin has lived at Halemakua for almost 11 years now. He gets daily physical therapy and receives the supportive, life-sustaining care he needs. He would not be able to afford to live at Halemakua without support from Medicaid. When asked, Alvin had a simple message for people in Washington, D.C., trying to make huge cuts to Medicaid. And I quote Alvin, "I'm not a politician," he said, "but I know that these programs really help those who are in need. I really hope that they would take a longer look at it and realize that these are programs the elderly and disabled need." End quote. People like Lester and Alvin are depending on us to keep up the fight against this mean, ugly bill until it's defeated for good.
Remember, repeal and replace, repeal and replace. They kept saying it over and over again. Every Republican running for office promised immediate relief from this disastrous law. We as a party must fulfill that solemn promise to the voters of this country to repeal and replace what they've been saying for the last 7 years. But so far, Senate Republicans have not done their job in ending the Obamacare nightmare. They now have a chance, however, to hopefully fix what has been so badly broken for such a long time, and that is through replacement of a horrible disaster known as Obamacare. The Senate is very close to the votes it needs to pass a replacement. The problem is we have zero help from the Democrats. They're obstructionists. That's all they are. That's all they're good at, is obstruction, making things not work. They say all the right things, and then they do exactly what they're not supposed to be doing. The Democrats aren't giving us one vote, so we need virtually every single vote from the Republicans. Not easy to do. The Senate bill that is being considered outside of the outright repeal of Obamacare will also provide emergency relief for the law's victims, and it will deliver truly great health care and health care reforms that our citizens want, need, and really should be demanding. Some are demanding. You'll see that at the voter booth, believe me. Here are just some of these terrific reforms that we will be doing if everything works out the way it should. The Senate bill eliminates the painful individual mandate. It eliminates the job-killing employer mandate, repeals other burdensome taxes, and will significantly lower Americans' premiums. It will stabilize collapsing health insurance markets and give Americans far more choice and far more flexibility. The Senate bill protects coverage for pre-existing conditions, and you don't hear this from the Democrats. They like to tell you just the opposite, and they didn't even know the bill. They run out, they say death, death, death. Well, Obamacare is death. That's the one that's death. And besides that, it's failing, so you won't have it anyway. It dramatically expands popular health savings accounts. It provides tax credits so Americans can purchase a private plan that is right for them and their families. It devotes substantial resources to fight the opioid, and this is a tremendous problem, the opioid epidemic. $45 billion is being put in so that the people of many states like New Hampshire, Ohio, and so many others that have such a big problem can be helped, and helped greatly. We're going to be fighting the drug problems very, very seriously in my administration. And it provides, among many other things, higher quality care and more flexibility for states to administer Medicaid to better serve their poorest citizens.
As we contemplate what's next, I hope we can come together across party lines to stabilize insurance markets and continue our work to provide universal health care for every American. I should think that each and every one of us who represents some 800,000, well, our entire state. I used to be in the U.S. House, and there you have districts. I represented about 800,000, but of course, as a member of the Senate, I represent the whole state. I should think that all of us who represents literally the 300 or so million people all across our country would care about the health care of every single one of our constituents, and Trump Care is not the way to ensure that. The fight continues. Madam President, I yield the floor.
Tomorrow, the Senate will vote on whether to allow this urgently needed bill to come to the Senate floor for debate. The question for every senator, Democrat or Republican, is whether they will side with Obamacare's architects, which have been so destructive to our country, or with its forgotten victims. Any senator who votes against starting debate is telling America that you are fine with the Obamacare nightmare, which is what it is. For Democrats, this vote is a chance to make up for the terrible harm they have inflicted on Americans like those who are with us today. Obamacare has been for them a nightmare. There is still time to do the right thing. And for Senate Republicans, this is their chance to keep their promise. Over and over again, they said repeal and replace, repeal and replace. But they can now keep their promise to the American people to provide emergency relief to those in desperate need of help and to improve health care for all Americans. To every member of the Senate, I say this: the American people have waited long enough. There's been enough talk and no action. Now is the time for action. We are here to solve problems for the people. Obamacare has broken our health care system. It's broken. It's collapsing. It's gone. And now it is up to us to get great health care for the American people. We must repeal and replace Obamacare now. Thank you. God bless you. God bless the United States of America. Thank you very much. Thank you.